There we are. Are we live? We are live. Welcome, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. Welcome to the VBF Facebook Live. I'm looking for it now on my phone so I can see the questions come in. It's February 2021. I hope you're all staying safe and well. Welcome this month's expert, Dr. Milton Waner, world-renowned expert in vascular anomalies. We're always excited to have him. So thank you, Dr. Waner, for joining us.
It's a pleasure. Always a pleasure, Linda.
So Emily, oh, okay, I see. All right, so we have one comment. So, oops, sorry. Hi, Alicia. Alicia is already saying hi. Alicia, Maria, and Lauren Gibbons, and 5 other people. Megan Elizabeth Curley, Rebecca Swigger, and Claudia Austin. Hi, ladies. Hi, everybody. Thank you for joining us. Like I said, I'm here with Dr. Waner. Hi, Maria and Madeline and Phyllis. Well, hi, Dr. William Phyllis Scheinbane from Los Angeles. Andrew's mom is saying hi to you.
Hi.
And Ari Mitchell. So we have a lot of people already on, and we've been on for like 60 seconds.
You know,
hi, Corinne. Corinne saying hi to you, Milton.
Hi, Corinne. You know, one of the things that I wanted to talk about is the last time that I was online, we spoke about the COVID crisis and how this was affecting children with vascular anomalies. And, you know, my impression is that it has had a significant effect. A lot of kids with port wine stains have missed 1 or 2 treatments. And in fact, some have even missed more than 1 or 2 treatments. We went down from being incredibly busy to lockdown, where we weren't allowed to do anything. So it has had a profound effect, but it seems to be lessening now. People are starting to come forward and get treatments. So the numbers are starting to increase. And I think we're playing a bit of catch up, but I think we will catch up eventually. And at some point, we're going to look back upon this and, you know, try and figure out whether this had a lasting effect or not. But things are starting to pick up now, and I'm very, very happy.
So do you agree with Dr. Stuart Nelson, who says even though they may have missed a lot, they can catch up?
Yeah.
Okay.
Yeah, no question. There's no question. But you know, the problem is you take a few steps back before you start going forward. And so the COVID crisis has really put people a few steps back. So it means that they'll have to catch up and move forward, and may take a little longer, but we'll get there. There's no question.
And for people who want to see you for surgeries, laser, any kind of treatment, you're wide open. You're taking cases every day. You can fit people in.
Yeah, correct. Yeah, there's no shortage. There's no question. We have sufficient OR time. The operating rooms have started up again full time. We require a COVID test within 72 hours of the procedure. And I think every operating room is requiring that. And the reason for that is that if a child or an adult has COVID and they have an anesthetic, this can have a significant effect on their lung functions. In fact, it can put them into a lot of trouble. So the last thing you want to do is have an anesthetic if you've got COVID. And so for that reason, we do COVID testing. And the other reason is we don't want them to spread COVID around, although we're all vaccinated now, but still, it's not something that we want. So a COVID test is required, and that's it. We move.
Are you doing them if the people show up? Like, are you doing the testing? Okay.
Well, the hospital has a facility, and they can get a rapid test done. I think the rapid test is 5 hours. So it's pretty straightforward. So we get that the day before.
So Alicia Maria has a question for you. She wants to know if it's safe for adults with an AVM to have the COVID vaccine.
Yeah, it should not be a problem. I encourage everyone to vaccinate vaccination is very, very important. And the COVID vaccine, looking at the mechanism of the vaccine, should not have any effect on people with vascular lesions. So absolutely not.
And have you made any plans to go to Europe for the surgeries that you do in Germany and Greece? What are your plans? And Israel, what are your plans?
Yeah, so we have a problem. Germany is in lockdown and much of Europe is in lockdown. So I can't really get in there. And they've canceled all non-urgent surgeries. So the hospital that I work at in Germany is only doing urgent procedures. And so the staff are basically just sitting around twiddling their thumbs because they don't have anything to do. Things will start opening up. The numbers are coming down drastically. Certainly for the United States, the numbers have diminished by 30, 40% per day, which is very significant. The number of COVID admissions in our hospital is also declining. It still remains high because we have some pretty ill patients, but the numbers are declining. So I think that by summer, we'll be able to resume normal activities. I'm planning on going to Athens to work with Stavros in May, I think May 15th or something like that. And I will probably be going to Berlin pretty soon after that. So I think that by summer we'll be back to normal. The Israelis have been way ahead of the game. 75% of Israelis have been vaccinated now.
Amazing.
So it's quite incredible to see that they really got down and vaccinated everybody. And they'll have close to 100% of people who want the vaccine will be able to get it fairly soon. So they've done an amazing job. So that will resume soon as well. So I think that by summer, all the trips will be back to normal. But here in the United States, we're pretty much back to normal.
Great. So we have some questions coming in. Megan Elizabeth Curleywood wants to know, do we know if there's any info on people with a port wine stain and O negative blood and antibodies? I have been negative 7 times and positive for antibodies.
Negative in terms of what?
Negative 7 times for COVID, but she showed up positive for the antibodies. So she was wondering if it's anything to do with the port wine.
No, not at all. No, not at all. She must have had an infection. It's clear if you show up positive with antibodies, you must have been infected at some stage. She may have had a subclinical or just a mild something, but clearly she was infected. So it has to be. Unfortunately, there's a lot of information floating around that clearly is just not true. There's a lot of speculation. There's a lot of stuff going on in the press. I think one of the things that goes against everything that we've learned is that, can a person be infected twice with the same virus? It's everything I've ever learned about viruses, bacteria, etc., goes against that, because once you're infected once, you develop antibodies. If you're infected a second time, you may have some sort of infection, but you cannot shed virus. In other words, you can't spread it, because in order to spread virus, the viruses have to be replicating in your body. And if you have antibodies, that's not going to happen. So,
okay, thank you. Yeah, we have almost 50 people on right now, so we have some questions. So Katerina Mihalovic wants to know, when will Greece and other countries open their borders to finish treatment with Dr. Tom Rees? COVID is not the only disease. While we wait, our children's condition is getting worse. My daughter and I are both vaccinated with Pfizer. So I guess she's anxious because, she's right. Well, these kids that have these malformations that should have been operated on last year, they're delaying it.
Sure. So what's happening is as follows. Dr. Tomris's wife is very not friendly, but associated with one of the people that sit on the committee in Greece. And one of the questions that Greece has just posed to the European Union is that they would like to exempt people from quarantine who have been vaccinated. So it's very important to get that card into whatever. Make sure you have a photograph of that card that shows that you've been vaccinated.
And
Because
keep it on your
probably,
phone. Yeah, keep a picture of it on your phone.
Yeah, very important, because I assume that very soon this will exempt you from having to quarantine. At this point, people in Europe are not differentiating between those that have been vaccinated and those that have not been vaccinated. And the reason for this is that too few people have been vaccinated. But things are opening up. By May, I'm pretty sure things will be wide open. That's the start of the holiday season, and the last thing the Greek economy can stand is another lockdown.
Yes. Amen to that. So Tim Rowe has a question. He says, I have vascular disease on my vascular birthmark on my right leg, port wine stain on my face, chest, back, and a little on my arm. My question is, I'm finding that the older I get, the harder it is in life. I am now 53 and my leg has gotten so bad that I'm walking with a cane. Is that something to be expected?
Yeah, so this is the natural course of vascular malformations, is that with time or with age, they get worse. This is because the vessels or lymph vessels that make up the malformation expand and get larger with time. So this is to be expected. However, you should not have pain. We can do a lot about pain, and treatment can possibly do something to alleviate this pain. There are medicines that you can take. Sirolimus will probably help with symptoms, and in clinical trials, sirolimus has been very helpful in patients with vascular malformations in terms of alleviating the pain. So I would investigate the potential use of sirolimus. I would also see if there's any treatment that can be done. If it's a vascular malformation, can you have some interventional radiological procedures? Some sclerotherapy might be helpful, possibly some surgery. So I would seek treatment specifically for the vascular malformation, because it's become more symptomatic, and also because of the fact that you're getting older. And it is true that with advancing age, vascular malformations do get worse.
Great advice. Christine Sky McEwen wants to know, are there any long-term issues with the use of propranolol?
No, not that we know of. You know, people have looked at this very carefully. In fact, there've been a large number of studies looking to see whether there are any cognitive changes or any changes whatsoever that we can identify. And to date, nothing has been found. So I suspect that the answer will be no. However, we must be aware of certain things. Propranolol does cross the blood-brain barrier, which means it does go into your central nervous system. Propranolol has been known to cause short-term memory loss, especially in the elderly, which is reversible. The minute you stop, the memory comes back. Propranolol is used to treat people with post-traumatic stress disorder because it can promote some memory loss, especially of stressful incidents. So those things you have to keep in mind. To date, people have not been able to find any consequence of this in children. The children appear to develop normally, meet their milestones, and have no long-term side effects. But we need to be cognizant of this. We need to, this is not a free ride. I don't suspect there'll be any problems, but there are other drugs that do not cross the blood-brain barrier. Propranolol does. There's a drug called nadolol, which is very popular in Canada and crosses the blood-brain barrier to a much less extent or to a much less degree. And so, you may want to consider using nadolol. Nadolol appears to be as effective as propranolol. So these are the things, but I must stress that to date, there is no evidence of any long-term side effect.
Important. So Selena Ossen has a question. Her daughter is 7 months old. She's been on propranolol for 3 months for a deep and superficial hemangioma. I'm worried that when the medication stops, the growth will appear again. How likely is this?
Okay, so this is called rebound growth, okay? And it depends on what age you stop the propranolol. Remember, the hemangioma has a life cycle. It grows and grows and grows, stops growing, and then starts shrinking. If you stop propranolol before the life cycle of the hemangioma has completed, then it will rebound. And in fact, there is literature to show this. So for instance, if you stop propranolol at 8 months, the rebound rate is very high. If you stop propranolol at about 11 or 12 months, then the rebound rate is very low. So that's important. Now, you have to differentiate between focal and segmental hemangiomas. Focal hemangiomas have a much shorter life cycle. Segmental hemangiomas, we know, can carry on growing for a much longer period of time. In fact, segmental hemangiomas can carry on growing for 18 months or even 2 or even 3 years or 4 years in extreme cases. And so in a very, very small proportion of patients, we find that we're unable to get them off propranolol because they rebound. This only happens with a small percentage of segmental hemangiomas. And for these patients, we do have tricks to get them off propranolol without rebound. We may have to introduce some other treatment or do something alongside it which can take care of that. So the answer to you is yes, if you stop propranolol too soon, you will see a rebound. For a focal hemangioma, which is by far the most common, it's probably okay to stop propranolol around 10, 11 and a half months. That's fine. You're unlikely to see a rebound. If it's a segmental hemangioma, then what we do is we treat for longer and we withdraw propranolol and see what happens. If it looks like the hemangioma is starting to rebound, we start up again, and then a month or 2 later, we try again. So we play cat and mouse with the hemangioma until we no longer get a rebound.
Okay. Well, we have a lot of questions, but this is such an important topic that you're talking about right now. And yeah. I've had my own ideas, seeing these patients since 2008 on the beta blockers. I have this feeling that some of them taper too quickly, like the protocols are within 2 weeks. Yeah. Why can't they do a slower, longer taper? And have you tried that, a longer?
You've mentioned this before. I have not tried it, but I think it's a very, very good idea to do a slower taper. So, this is a very good idea. But once again, you've got to taper at the right time. You've got to start coming off at the right time. If you come off too soon, it'll rebound. This is a problem.
Okay. So Anya Banazek from Italy says, hi, Dr. Waner and Dr. Linda. Dr. Waner and Dr. Meyer will always be our heroes. Thank you for everything you did for my son. That's Anya Banasek.
Yes.
So you know her.
Thank you.
Yeah.
And thanks for acknowledging. We appreciate it. Thank you.
So Lillian Z-I-E said, "Hi, Dr. Waner. I'm Sadie Prevost. You met me as a baby back in Arkansas in 1997. I just want to know if you still remembered who I was all this time." That's
You know what?
adorable.
If you send me, I'm very bad on names. My hard drive is full, absolutely full. And in order for me to remember another name, I have to displace one. But if you send me a photo, I'll certainly remember, because I remember photos of all the children that I treated. So
I'm
the
the
answer
same
is
way.
I'm pretty
So.
sure I do. Yeah.
So we have another question from Selena. My daughter is 7 months old and has been on Propranolol for 3 months for deep. Okay, so you already answered that.
Yeah, so at 7 months, I would not stop. That's too soon. If you stop now, the likelihood of rebound is pretty high. I just based on recollection of the numbers, it's around 60, 70%. You will see some rebounds, so I wouldn't do it.
Okay. Pamela Berry Reddy, she wants to know if a COVID-19 infection, like actually having it, would pose an increased risk to those with vascular lesions.
We don't know of any at this stage. We don't. You know, it's only immunocompromised people. And remember, Sirolimus is an immunosuppressant. So I'm not sure what's been happening to patients on Sirolimus, because Sirolimus is an immunosuppressant, but patients who immunosuppressed are more likely to get a more severe infection. But if you just have a vascular malformation and you're not on treatment, I don't think that it'll have any effect. But once again, I don't know, I don't know what the circumstance is with people on Sirolimus, but they would clearly have to get vaccinated. And I wonder if you need to be off Sirolimus to be adequately vaccinated. I would imagine so, because it does affect your immune system.
I wonder if there's any information about that on the ISFA website or somewhere where we could find it. Maybe we should try and.
Yeah, I'm actually gonna pose that question. I'm gonna send that question to Laurence Boone and see if she comes back with an answer. But
good idea. So again, we have a lot of questions. Charmaine Harrell wants to know, is there any way that we can do appointments with you to review and videos and so forth via telemed with you?
Yeah. So
my daughter has a venous malformation in her face. We are in Australia and have consulted with Dr. Pennington, but we would love to do a review with you and your opinion.
Absolutely. I've been doing telemeds, doing a lot of telemeds, and so there's absolutely no problem. It's very difficult to examine a patient via telemed, but what I suggest you do is as follows. Send me photos. A set of very good photos will help a hell of a lot. And then if there's an MRI or any such study, if you send it along, I'll be able to open it and review it and speak to you. So the answer is yes, I'm happy to do a telemed, and I'm happy to review everything.
And someone from VBF will post.
And I'm an Aussie, so there's no problem at all.
They'll post Dr. Waner's email address directly in the string here, so you'll be able to write directly to him. And yes, you did live in Australia for a while.
I'm an Australian citizen.
There you go. So. Mac EO said his son is 3 and had a vascular malformation that is generally dark and flat, but if he leans forward or upside down, it fills with blood. It's on his forehead and eyelid. Can we do anything to reduce the swelling and filling?
Yeah, so the answer is, how old is the child? 3?
3.
Yeah, so this looks like a venous malformation. This is typical of a venous malformation. If you increase venous pressure, it fills up. It fills up with gravity, because if you turn the child upside down or the child lies flat, the venous pressure increases and it expands. And the answer is yes, it can be treated, and we can stop that. We can treat the venous malformation, and it's possible we can get rid of it. So you should come in for a consultation. A patient like that should probably be seen in person. You know, there's a lot of information we need to gain and a lot of important stuff we need to know about. But the answer is yes, it can be treated.
And just to let everyone know, our massive clinic, free clinic with free laser, free lodging for one night will be on Saturday, October 9th in New York City. Dr. Waner will be there.
Yeah.
And if you work with him ahead of time, you can even schedule an in-office at his office visit or even procedures if you want to coordinate this. So again, we'll be launching pretty soon in the next few weeks on birthmark.org/conference. We'll be loading we'll be going live with the registration. So that is one way to see him and also to possibly work something out in October. So Gina Sulfan said, with what we know about the increased risk of blood clots with COVID, what risks does that bring to hemangiomas, port wines, and other vascular lesions?
Yeah, so we know that patients with venous malformations have abnormal blood clotting. They have continuous consumption of clotting factors, which takes place, and this results in the formation of what they call Phlebolous, which are these hard stones that develop in venous malformations. But there is a chronic consumption of clotting factors in patients with venous malformations, and so the clotting can be adversely affected. And if they develop COVID causes clotting to take place, but in many of these patients, a lot of the clotting factors are kind of used up. So that sort of seems to balance. We've not looked at patients who have venous malformations and have COVID. No one's ever studied this and no one's reported on this. And I think it's an excellent question, by the way, something that we really need to look at. But I suspect that they're less likely to have a problem with clotting because these patients have chronic consumption of clotting factors. And I assume that they would not have enough clotting factors to develop this massive clotting which takes place. But this is an assumption, and this is theoretical, and I may be wrong. No one studied this, but it's an excellent question. Somebody's thinking very well. Yeah.
Thank you, Dr. Waner. So another one of your fellow citizens from Australia is writing, and it's Horsberg. And she says, hi, Dr. Linda and Dr. Waner, viewing from Australia. My son has three hemangiomas on his head. The left side of his face is more veiny than his right side. Is this potentially unrelated or common to having hemangioma on his head?
Okay, so hemangiomas have a very, very prolific blood supply. There's a tremendous amount of blood passing through these hemangiomas. And in fact, if you have a very large hemangioma, like a massive parotid hemangioma, about 20% of your blood volume can be passing through this hemangioma at any point in time. So because there are 3 hemangiomas in the head, there's a lot of blood swishing through these. And so the arteries and draining veins would be more dilated because there's more stuff, there's more blood going through there. So the answer is yes, it's related to the hemangiomas. As the hemangiomas involute, there'll be less and less blood passing through, and eventually things will normalize. Sometimes they don't completely normalize, and in those circumstances, we can do something about it. But it's normal and it's related to the amount of blood flowing through there. And there is an increased blood supply and drainage from the hemangiomas. So that's why you see the dilatation of veins on the side of the face.
Thank you. So Payson Stanfield Awe says, I just hit a certain older birthday, and with it, my port wine stain, which covers half of my face palate, inner ear has become itchy. It's always had a lot of bumps. These bumps are getting darker as well. So another one asking about my age, why does it get worse with age? I was born with seizures, but haven't had them since 5. Worrisome that it's suddenly becoming symptomatic, and sounds like she's talking about some blebs,
Yeah.
that come with the
Yeah.
vast aging port wine.
So I'm actually doing research on this at the moment. Linda knows about this because she's involved, but we're looking at cobblestones. Cobblestones are the lumps that develop in port wine stains. Now, cobblestones can be prevented with treatment. And in fact, early cobblestones are very easy to treat with laser. So my suggestion is that you're starting to develop cobblestones. You need to have your port wine stain treated to try and prevent these from developing, because once they develop, they can be very disfiguring and very difficult to get rid of. We know how to get rid of them and we know how to treat them, but prevention is better than cure. It's a lot easier. So my advice is, you're getting cobblestones, seek treatment. That's important. And as far as seizures are concerned, I think Ann Comey should respond to this. It depends. Is the patient on seizure medication? Has the medication changed? Or has the patient ever taken seizure medication? These are questions that a neurologist should answer. But as the port wine stain expands, the port wine stain in the brain is also doing something similar. So that's important to consider.
Yeah, I think it's interesting. Maybe they could email me so I could put them in touch with Dr. Comey, that they said that the seizures stopped at age 5. I don't know whether they're on medication or not, or if there's some phenomenon which has somehow made this person it would be interesting for Dr. Comey to.
Yeah, I mean, this is an excellent question. What happens to seizures as the patient ages? What does Ann Comey say? These are important questions.
Agreed.
Or Anna Pinto.
Mm-hmm. So Claudia Austin says her son is 15 months old. He has an extensive port wine stain. How do you treat overgrowth? Now my son has started to walk and his leg is bigger and longer. He sees the geneticist in April. Dr. Lord suspects a mutation of RASA1.
Okay, so it's actually fairly simple. The child should see a pediatric orthopedic surgeon, and they're going to measure growth and plot growth. And just before the child is fully grown, they'll determine by how much the leg is too long, and they'll stop the growth on that leg by fusing the growth plate and letting the other leg grow to catch up. So this is something that can be adjusted. This is something that can be treated, and it's something that falls into the realm of a good pediatric orthopedic surgeon. They face this consequence a lot, and it's something that can be controlled.
Thank you. Pamela Berry Reddy says her 9-year-old has a segmental hemangioma on the lower lip and experienced rebounding after stopping propranolol. We've been on propranolol off and on for many years. We scheduled to begin NDYAG soon. Do you have any experience with this type of treatment when a child did not get full results from the propranolol? I think that's a great question.
Yeah, that's an excellent question. You see, this is an example of what I was speaking about. A small percentage of segmental hemangiomas just keep growing for a longer period of time. I'm nervous when I hear treatment with a neodymium YAG laser. I would not consider this at this time. Now, I'm not the treating physician, so I don't want to comment on what another physician has said or done, because I don't know the circumstances and I have not examined the child. However, we do face this, and there are ways to stop the proliferation. There are certain other drugs that can be used. Vincristine is one, and there are certain combinations that can be used. And there's also surgery. I'm very nervous about using a neodymium YAG laser. The incidence of scarring is significant, and the therapeutic index is very narrow. That means that the power setting that you need to get an effective treatment is in a certain range. And if you overstep that by just a tiny fraction, you can wind up with a scar. So you really need to know what you're doing with a neodymium YAG laser. The likelihood or incidence of scarring is very, very significant. I would like to see a photo of that patient because it's possible that surgery may be helpful. It's possible that something else may need to be done.
I was going to say that to send you a copy of the pictures, and
Yeah, so
we're
they can,
posting your
yeah,
email.
so they can send it to my email and just outline the circumstances, the fact that this is a child with a segmental hemangioma. I'd want to know the age of the child, how long the child has been treated with propranolol, and what's been happening. And I can perhaps offer an opinion.
So for those of you, I'm not sure, I haven't seen it yet, but it is birthmark.org/Waner, WANER, and that will go through the VBF experts
Okay,
page.
but once again, you know, just to that parent whose child is going to have neodymium YAG laser treatment, I'm very nervous about this. And once again, I'm not the treating physician, so I can't pass judgment. I've never seen your child, but I know that neodymium YAG lasers can cause scarring, so I'm very concerned.
So we can get you that picture.
Opinion.
Yeah.
Sorry?
We can get that picture to you, and you can
Yeah.
give her an opinion.
Yeah, I would
Very
like
important. Elizabeth Villarreal says her daughter is 2 years old. She has port wine stain on her left side. It doesn't cover her. Yes, her left side. It doesn't cover her eye though. But since she was born, she has her eye is red, and the ophthalmologist can't figure out what's causing the red eye. They did an MRI to see if it's because of the port wine, but it's not the port wine. I'm worried if it could be because of the port wine. And she's saying again that the port wine is on her left side, but it doesn't cover her eye. But Dr. Comey says that doesn't really matter all the time.
Yeah, I mean, the eye may be red because the disease process. First of all, I'd want to know, does the child have glaucoma? Does the child have eye involvement? Sometimes we see dilatation of the conjunctival vessels in a patient with a port wine stain. The same as a patient with a port wine stain that involves the mucosa. If you open the mucosa, the mucous membrane in the mouth. If you open the mouth, the mucous membrane is red. So if there is involvement of the conjunctiva, the superficial layer of the eye, then the eye will be red. So I would want a pediatric ophthalmologist to have a look at this eye, make sure that there's no glaucoma, but I think that the redness may be related to the port wine stain, especially if the port wine stain goes close to or involves the same segment as the eye. Because remember, these things are segmental and the body develops in segments. So if that segment is involved, then the eye will be red. And we see this from time to time.
Thank you. So a representative from Kennedy's Cause posted, she said, on Sirolimus for 8 years, Boston team okayed COVID vaccine, received both doses, fever, body aches after second dose. Maybe it would depend on Sirolimus dose or individual case.
You know, I don't know. I really don't know. I'd be interested to know if that patient developed antibodies.
Right.
and what the level of antibodies are. You know, we just don't know. I know that Sirolimus is an immunosuppressant, and does this have an effect? Yeah, I imagine you can get vaccinated, but the question is, what sort of response does the patient mount, and how significantly is the immune system impacted by sirolimus? We know it has an effect. So what I'd want to know is, has this patient developed antibodies? And this will give us an idea of
And, and
whether the patient's immune.
the same responder from Kennedy's cause, she's got another caveat that's pretty interesting. She's saying, Ari, regarding the COVID vaccine and sirolimus, just want to add that the adult working in a hospital, but Boston team also advised vaccine may not be as effective if used precautions.
Yeah.
Interesting, like that you say, maybe what we should do is recommend these patients that are getting the vaccine get tested for the antibodies, because they may assume they're immune and they're not, which is very interesting.
That's one issue. I mean, we just don't know. We're in uncharted territory. What effect does sirolimus have on immunization? Is it preferable to bring the child off sirolimus for a short period of time, immunize, and then go back on it? You know, that's perhaps something that can be considered. Or you need to be off sirolimus perhaps for 2 months, which I don't think is catastrophic. The only way to determine this, or to determine whether the child has developed immunity, is to look for antibody levels, and that'll give you an answer.
Makes sense. So we have a little over 15 minutes. This has been going very well. We have quite a few people. Scott Couples says hi to Dr. Waner and myself. He is with the Air National Guard, and he is administering, his team is working at the COVID vaccine site in New Jersey. So thank you for serving, Scott, and, you know, always doing your best with our Global Ambassador Program. And another one of your patients, Ava Piles, and you remember Ava, we saw Ava. So she's been getting laser treatments in her eye area, and she wants to know, is there any other laser that should be used on her? I think maybe she might be thinking about the resurfacing. Would you consider that, or?
Yeah, so if a patient has had ulceration, which has resulted in some degree of scarring, then we use resurfacing lasers to try and alleviate or improve the degree of scarring. And we've been doing this for some time, and it definitely does improve it. So the answer is yes. We use pulse dye lasers for the redness, and we use fractional CO2 lasers to improve scarring. There are other lasers that can improve scarring, and but my preference is to use a CO2 laser, and that's what we do. And also, if there are scarred areas, we sometimes consider excising these areas, and we get very, very good results, because a simple excision with a wonderful, well-placed scar can sometimes look a hell of a lot better than a large depressed scar from a bad ulcer. So, in fact, I had a patient just recently that I did do this, and she has done extremely well, incredibly well, and I'm very pleased with the outcome. So,
well, Ava will be seeing you at the October conference, so maybe that'll be a good time to assess whether
absolutely,
you should,
absolutely.
Consider surgery.
I look forward to seeing you, Ava.
Yep. So one of your patients from Bulgaria is saying, greetings, Mariah Helavachiva is fine. Thank you for everything, and be healthy.
Well, it must be very late in Bulgaria. It's probably around 1 a.m. So it's pretty late. Thanks for staying up late.
To say hi.
Yeah.
So Megan Curley is saying that her seizures stopped when she was a child, but then they came back in her 20s, and she's got the Sturge-Weber. So that's Very
Yeah, it's important. You know, we know that with Sturge-Weber, and this is very, very important, seizure control is very, very critical. This will make a difference, a significant difference in cerebral development. So seizure control is very important. And so I suspect that as the patient gets older, the possibility of seizures will increase, and so will the medical needs of the patient. In other words, the amount of seizure medication the patient needs may increase because the port wine stain expands. The vessels that make the port wine stain expand, and if they're doing it on the outside, they're doing it on the inside as well.
That's why we call it a progressive lesion, right?
Correct, yeah.
So it sounds like another one of your patients, I cannot pronounce her name. I might not even do well on this city.
Maybe you shouldn't, Linda. You're
Well,
gonna
she's saying,
destroy it.
you know, are you traveling to Eberswalde? Eberswalde?
That's Eberswalde. It's
Okay.
Berlin, yeah, or just outside Berlin. The answer is not yet. They're in lockdown. They're only doing urgent surgeries. They're not doing routine surgeries. So I can't go there yet, but I suspect that I'll be there in summer. So I suspect that by May, June, normal activities will resume. Once they resume, I'll be going back there. And I've got a lot of making up to do, or a lot of catching up to do. So the answer is yes, probably in summer.
So Tim Rowe, who wrote earlier, he sent a subsequent, and he's the one that has the malformation of the extremity. And he said he had an ablation. Now they won't touch him because he had an important vein removed. The current vascular doctor said he's afraid to touch me because of that risk of losing my limb.
Okay, so yeah, I understand what's going on. This is something that Bob Rosen has studied extensively. You know, patients, it seems that patients may have, there are superficial veins and deep veins. And in patients with vascular malformations, it appears that one of the systems is not functioning. And Bob Rosen has studied this extensively, and he's found that even though it appears that one of the systems is not functioning, it's there and is functioning, and he's actually shown this. So my suggestion to that particular patient is as follows. Number one, you can consider using Sirolimus, and that may be a good option. Number two, you can see somebody like Rosen who looks very carefully at both systems and will determine the intactness of the alternate venous drainage system. Obviously, he's going to look at this very carefully, and he'll tell you what can or cannot be done. So you have two options. One, Sirolimus, and that's a good option, and Sirolimus has been shown to improve symptoms. Two, you can see somebody like Rosen who looks at this very carefully.
So a similar, Batul Kaushal, you've met her. She came to our gala and she's had procedures with Dr. Rosen for extremity malformation. She's one of our VBF's diehard supporters. And she wants to know, because she has KT syndrome and she's 57, is it safe for her to get the vaccine?
Yeah, absolutely. I wouldn't, yeah, there's no contraindication that I know of. So the answer is yes. And incidentally, somebody mentioned symptoms with the second shot. Symptoms are good. That means you're mounting an immune response. And so that's really not bad. I got symptoms with my second shot.
Good to know. So if you get a little sick, that's all right because your immune system's kicking in.
Yeah, no, I felt lousy. I felt positively lousy, but it happened 24 hours later, and I felt absolutely feverish and sick for about 24 hours.
But you know, now you know you're immunized?
yeah, I have antibodies. Yeah.
Oh, that's great. A question from Tina D from Manila in the Philippines. She says hi to both of us.
Yeah.
She said, Dr. Wainer treated me back in the early 2000s in Arkansas when I was 29 years old with YAG laser for a venous malformation that was starting to block my airway. Thank you so much, Dr. Wainer. It was a life-changing for me. It's good to see you here, and you seem to not have aged. Day. I'm 47 now, and my venous malformation in my neck jaw area does seem to be getting more problematic as I age. I would like to schedule a telemed consult with you.
Yeah, absolutely. I do remember you. So, yeah, I do remember this patient. So, yes, I'd love to see you, and we can talk and see what we can come up with. So that's good.
She was hoping you would go to Australia for a clinic, so maybe we should put Australia on the VBF I-team list.
Well, yeah, that's not a bad idea. I'd love to go back to Sydney.
Yeah.
Yeah.
So, you know, we're caught up with the questions. More will be coming in. We have 9 minutes left, as I told everyone, and Dr. Wainer has said it several times. And Corinne, our director of patient advocacy, has posted his email, 2 ways to get him through VBF, and then direct email, which she posted. So if you want him to just look at your photos or imaging or set up a telemed consult, he's, scheduling pretty soon, no issues. He'd be happy to do it. Roberta Tenay we got 2 questions. So when will you come back to Berlin? Do you know if you'll be soon? And
yes. So I'm talking to Dr. Meyer periodically, and I will be coming back to Berlin. I'm sure by summer I'll be coming back. The answer is yes, I will be coming back to Berlin as soon as I can, and I think that that'll happen around summertime.
Great. Gina Sulfin has a question. Do you know if there's any connection between vasculitis, autoimmune related condition, and various vascular malformations? I have both and don't know if these are completely separate issues or if they can be related.
Okay, so vasculitis is related to some sort of immune response that gets set up against blood vessels, whereas a vascular malformation is not. So there does not seem to, I do not know of any relationship. Vasculitis is an autoimmune condition. Vascular malformation is not. It's a developmental condition. So I do not believe that they're related.
So you have a shout out from some friends from quite a ways back, from Dinah and Marvin, Dinah Gonzalez and Dr. Marvin Calvert,
sure.
and Dr.
I
Dinah
remember them, yeah.
Gonzalez, and Marissa's in college. So, I mean, it ages us well when we hear about our.
God, yeah, but it makes me feel old.
Yeah, but somebody just said you don't age, so you have to take the good with the bad.
I can feel it. If I drop a coin and if it's less than 25 cents, I don't bother picking it up. It's too painful. So I can feel.
I'll have to remember that and follow you around and start picking up those quarters.
Yeah.
Okay. Again, if you want to do a telemed with Dr. Wainer, we're wrapping up here. We do have 7 minutes left, so we can get some questions in. He is doing telemed. B, his office is wide open. He and Dr. O are treating with laser. They're doing surgeries. They're doing YAG. Everything's back up to normal. They can provide letter for you for travel. He explained in the beginning that, about quarantining. If they're immunized, you may be exempt, right? If you're fully vaccinated.
Correct, yeah. So what they recommend, first of all, if you're immunized, you should not have to quarantine. Secondly, they state that, if you come into the country, or if you come into, to the country, you're supposed to have a COVID test before you leave, and you should have one within 24 to 48 hours of arriving. And if that's negative, then we're happy to go ahead and perform whatever procedure. But there have been patients who've tested positive some time afterwards. We know that the incubation period can be quite long in some patients. So it's not absolutely foolproof, but you know, these are some of the things. But, you know, remember, we've had a hell of a lot of cases. We're a red hot center for COVID in the United States relative to other countries. So it's like coming into a furnace, you know. So,
Well,
you
let's
know,
just hope that this furnace cools down really soon.
well, it is. It's cooling down very rapidly. As I mentioned, the numbers are decreasing here very rapidly. And I think we're a little ahead of Europe in terms of this. And that's probably because we have a lot of immunity and we're also vaccinating at a high rate. I think we're almost up to 10% of people have had one shot. So that's pretty good. And I think 3.5 to 4% are fully immunized. We need a lot more, though.
Yes, we do. So Monica Eden writes, "Hi, Dr. Waner. We came to see you from Tennessee about 15 years ago. We couldn't find anyone to diagnose my daughter. So I found you online and we came." So she's saying hi to you.
Hi.
They're watching.
Did you come to New York or Tennessee?
It would,
I
no, no,
mean,
no. I mean,
Arkansas.
if it was 15 years ago, you were in New York because you came in 04.
Oh, okay. Yeah, that's right.
I know that. I know it better than you. 'Cause
Yeah,
I
you
was-
know what, Linda, you're younger than me, so what can I say?
Well, you know, it's all those decades that help. And Glenn is saying hi, Monica's saying hi. So once again, as we wrap up here, we can take one more question. Oh, Tiffany Hilliard, she said, no question, just want to say thank you to both Dr. Linda and Dr. Waner. Our daughter Haley will see Dr. Waner in a few weeks, and you've
Good.
both been very helpful
Excellent.
to us.
Yeah.
So.
Actually, I'm looking forward to meeting the Hilliard family and to finally seeing their daughter. You know, she's had such a difficult time with ulceration after ulceration. So I'm glad that that's behind us and we can look forward to getting back on a path to treatment. So I look forward to seeing the Hilliard family. And, you know, Linda, you've done a hell of a lot for this family. You've helped them a tremendous amount. And so thank you for that.
I appreciate that. So very interesting. Lori Lewis is saying, I just joined in. I had my first dose of the vaccine and my venous malformation is very painful for several days. Any information on this? I find that interesting, but it would make sense, right? Because the venous malformation is excess blood volume. Maybe this is exacerbating it, but she said it was extremely painful for days following her first dose.
You know, I wonder if it's coincidental or maybe she formed a Phlebolous. You know, venous malformations become painful when they expand. They become painful when clots form. And I don't know. I don't know a correlation. I'd have to think very carefully and maybe speak to one or two people. But that's very interesting.
I think so.
She's saying that the venous malformation expanded and became painful.
Yeah, she said,
which vaccination?
I don't know. We put Lori, so Lori's watching us right now, Lewis. She said, I had the first dose and my venous malformation was painful for several days. Any information? So she's watching us. Maybe she can tell us whether she had Pfizer or Moderna. Yeah, I haven't seen a response back from her.
The only thing I can say is that there must have been some blood clot formation.
Oh, she had Pfizer.
Pfizer. So there could have been a thrombus forming or a blood clot.
Yeah, but you know what? If she just had her first dose, then she's supposed to go back in 3 weeks. Maybe she better look into this and have an ultrasound or something. You know, make sure there's not something going on. Because I mean,
No, I don't know of anything. I really, I'll look into this. If they email me, I'll definitely look into this. I'll make some inquiries around the country, around the world, and see if anyone's
yeah,
experienced this.
yeah. So Lori emailed.
Is this a
Dr. Waner.
venous malformation
Yeah, she
or
says
glomovenous?
no, she said it's venous. It's
And where
venous.
is it? So I want to know, number one, where it is. I'd like to see a photo of it if I can, and how old the patient is, and then I'll look into it. I'll make some inquiries.
Yes, so she'll write you back. So it's 6. We have one more question. Are there ways to prevent the formation of Phlebolous, and should we be concerned about them?
Okay. No one's ever proven that there are ways to prevent the formation of Phlebolous. The Phlebolous are blood clots that calcify. Just 1 second, Aaron, I'm on I'm on a live thing. I'll call you back in 5 minutes. Sorry. That was Aaron Fay. What was I saying? All right.
About the Phlebolous, is there anything to be done? And yeah.
So, this is due to a consumption of blood clotting factors. And the Phlebolous are actual blood clots that have become calcified. And they can produce pain and all sorts of symptoms. And if you palpate the venous malformation, you feel these stones there, and these stones are Phlebolous. So how to prevent them? Well, one of the ways you can prevent them is by having an anticoagulant. Lenox, low molecular weight heparin, will probably prevent Phlebolous formation. Okay. Well, I don't know this for certain because nobody's ever looked at this in a controlled clinical trial, but Lenox stops blood clot formation, and Lenox improves some of these symptoms related to venous malformations. So that's one way of doing it. And one of the things you do is you look at certain blood levels. So for instance, I would look at the D-dimer level, and I would look at the blood clotting factors, the fibrinogen level as well. So I would look at D-dimer and fibrinogen, and if they're in bad places, if they're abnormal, then I would consider going on Lenox. The trouble is Lenox has to be injected. It can't be taken by mouth. But if there's an issue going on, it can be used for a short period of time. And some patients are even using it for a longer period. And there are other anti-clotting drugs that can be taken. So I suspect that the answer is yes. I have no definitive answer, but I suspect yes.
Well, that's it for us, Dr. Waner. We're at 6:03. This was an amazing session. We never let up from the questions, and we had upwards of 50 people on at once. So as usual, you just knock it out of the park, as Corinne says.
Oh, thank you.
She could listen to you all day, and we appreciate everything you do. Everyone has your email on here. They can go back and re-listen to this. We keep them up from January of 2017. We have 12 a year, and they're full of valuable live information from experts.
And Linda, thank you for all you do. And you bring so much information to so many people. So thank you. If it wasn't for you, none of this would be available. So thank you.
Team VBF, Team VBF. Thank you all, and we will see you next month when we have Dr. Coletti from Italy updating us on what's going on in Europe with COVID and what's going on with getting treatments in Europe. And you heard a lot from Dr. Waner, but also he is an expert like Dr. Waner, so you can come back next month and hear from him. And then in April, we will have Dr. Stuart Nelson. So now you know next month and the month after who our experts will be. Thank you all. Thank you, Dr. Waner. Stay safe. Take care of yourselves, and we'll see you next month. Thank you.